The healthcare service delivery system in Kenya, as some may already know, is divided into 4 levels. At the top of the chain, national referral facilities exist to deal with research and highly specialized cases that other levels are not equipped to handle. Beneath this are county referral services, which include hospitals operating in and managed by a given county. The third tier includes primary care services such as health centers and dispensaries, providing basic health care in emerging towns, urban centers, and small villages. In my estate here in Nairobi, I often visit the dispensary when I need painkillers or cough medicine, and before today, I thought this was the lowest level in healthcare. But as I've recently discovered, there is a level that is seldom discussed, a level rarely considered. Let me take you to the people. Let me take you to the community. The slow feet drums the earth in third beat progression. The golden dust of the Kenyan arid is fashioned with a beauty so rare, a treasure with no equal. Song and dance and the spring jumps enhance this glare with smile flares. Behind their song lurks a dreadful reality. With a maternal mortality rate of 1,100,000 births and an under 5 child mortality rate approximated at 142 per 1,000 live births, the dream of a blossoming society hangs in the balance. As darkness sinks and the dark sets reveal the blanket shielded in the shaft of light, how is this possible, you ask? This is Samburu.
The main challenge in Samburu County is that there was an existing wide gap between community healthcare, which is level 1, and high levels of healthcare. We had also a problem of antenatal care, clinic mothers attending was a problem. Immunization defaulters. We had also a problem of community ownership of the facility. This affected the people of Samburu County in several ways. One, there were a number of deaths related to mothers, especially when they are giving birth. There are also deaths for the under 5 children. There was also the issue of malnutrition, which was affecting both the mothers and the newborns or the children. Lack of immunization for mothers and children and limited capacity of CHVs was also a challenge. A minor problem was limited support from other community members, such as fathers and other caregivers.
Wamama hawangehitajika kukosa nyumbani muda mrefu kama muda wa lisali moja na kwenda juu. Wasee walikuwa wanahitaji wamama wawe hapo nyumbani, wachunge watoto wa mbuzi, watoto wa ng'ombe na kuwapikia chakula. Desturi hiyo ilikuwa imesuppress sana mambo ya kufika hospitalini. Pia hatukuwa na hiyo mafundisho ya kwamba ni muhimu mama kuja hospitalini ama kufika kwenye kituo cha kliniki. Walikuwa wanakosa kuja kwa sababu ya moja, mvua, na pia usalama ilikuwa inachangia pakubwa.
Ilikuwa vigumu sana kwa sababu unakuta sasa sehemu kama hii tuliyoko sasa hivi Sirata, hii peke yake ndio ilikuwa facility ya hospitali, na by that time hata kufika hapa ilikuwa ni ngumu sana. Watu wanaishi sehemu mbalimbali na tena watu hawakuwa na ile elimu ya kwenda hospitali, so watu walikuwa wameshikwa sana na ile desturi ya kwamba hawakuwa naona umuhimu ya kwenda hospitali.
Sasa unakuta mtu anagonjeka nyumbani lakini hajui hospitali faida yake ni nini.
Alafu unakuta pia hospitali ilikuwa ni kamoja tu na hakuwa na bidhaa ambaye zilikuwa zinatoshelesha mahitaji.
Kuna tabuni na ya wa mimi ya ba sipitali na gatai. Nimiki yo ajo ke tukin kai. Nimiki yo ajo mai gutenki. Na ona na to gutuni po. Nimiki aba shui. Na ona na to gutuni po ke apa on kara on to mono ko shop beta na ba ko yo. Itu na ko ngalo mo le sipitali to no mo tungane. Ni matul ke. Kena ke cho nimiki yo daw. Ai na to ka bana yo chop po ke ni apa. Ngamite.
Kegol akan niya ba wala ngam mito kana na kata kiyo mito ke kundu so kiyo para bage miyo baga ajo kara winjon kaya kana miya ba aja kin kai kina kata na ko gol niya kata ba mula ba ngani kilini kora ba ne tini inde ba ngani shot kan mito kana yo.
The problems were affecting the economic status of the county because most of the people who are living in the county are economically poor, and if you add diseases which affect them, which used to affect them mostly, now you add more problems to them. Economically and even socially, they become more poorer.
After seeking counsel from the community, I learned that someone, somewhere had come in to stitch the seam that once hung open, swallowing mothers, newborn and young children.
The main aspect that has prompted the maternal, newborn and child programs in this area has been the indicators of death. Death has been so much high around here, especially among us young kids and young children, and also the cultural aspect, which has really brought about the increase in the same.
Our main objective is to strengthen the community health systems by improving health services for women, children, newborns, and adolescents in Samburu.
The program involved community health volunteers and other interventions to bridge the gap between formal healthcare system and the community.
We have improved the health services by training healthcare providers. We have also trained community health workers, and finally we have instituted a community-based health information system. When we go to the Samburu, the main indicators were quite low. For example, antenatal care was only at 52%. From the start up to now, when we have done the midterm, we are now at 56%. Skilled birth attendance was only at 35%. We have moved now up to 39%. Exclusive breastfeeding, which is also a main indicator, was only at 83%. We have moved it up to 93%, from 80 to 93%. So the figures have really, you may look at those figures as in terms of percentages as not significant, but for us, moving those figures, even a single % is very key.
We implement through the community strategy, whereby to bridge that gap between the formal healthcare and the community, we form what we call community units.
The role of the community health volunteers is mainly to mobilize the communities to be able to utilize the services.
They act as a bridge between the formal healthcare and the community, particularly the household, at the household level.
They collect information on various health issues in the community, and this information is analyzed and used by the communities to make decisions during what we call dialogue days and community action days.
Our community members have really gained through visiting the facility to get what's called antenatal care, where before my community members never had before. It has also taught the fathers on the responsibility part of it, because on the cultural aspect, it tied the father to be the decision maker, if the mother has to go to the facility or not, if it is to take the local herbs or not. And also has taught the mothers on the importance of hygiene, importance of visiting the facility, importance of ANC, and also on other aspects like the community health volunteers following up the defaulters.
Sasa tangu sisi tumetrainiwa na sisi tumeenda ndani ya hiyo watu wamerefuka, wameelimika. Sasa hata wamesaidika juu kuna watoto wengi wanafa ama mama wakati ya kujifungua.
Kato baba katiyo bakashomo kilini na tiyo wake na ko pai isaidiana kondo wake tana na bad wake na tana tundu wake tana ni kumjansi kunake.
Korna doang kita nata engkere
naatimisho nintanaga nongerera kumbia mitoki cho nanana nikina navenza meta inga to kumicho meta pagani ta baga bete ya bara ko yo bi unjarai nga sai sho kulo kutoka nyakata ipiu nchonkare nchona gondo bok na idunya kera yatama kwertata mugure na bagada ina to kun traite pa mugara kada bi unjarai no ni de sepetali nentana ngora pa tinille ya alkena penya na kita langota na matankare na mincho kulle.
The number of mothers who are delivering at our facilities has gone up. The number of children who are completing immunizations has also gone up because our community health volunteers actually move from house to house to take register. And they know those children who have not been immunized and they recommend for them to go to their facility to be immunized. They know those mothers who are pregnant and they also recommend them. They tell them to go to the facility to be examined, and when they come to delivery, they also deliver at the health facilities. The economy has been affected positively because the number of people who are falling sick has reduced. So if you see if the number of people who are falling sick has reduced, that means now economically they are doing something for themselves.
Sisi tunashukuru sana hii project ya AMREF sababu ile ujuzi watu wako nao sasa ni kutoka kwao, lakini kazi bado kwa sababu bado sisi wale wamekuwa trained wanataka support ili kufikia wale ambao wa mbali.
In the community units that the AMREF supports in conjunction with the Ministry of Health, yes, we have seen marked improvements of the maternal, newborn and child health indicators, but this is now not enough. The project needs to be upscaled.
We hope that these lessons learned will be upscaled across the country so that other regions that have similar problems like Samburu can utilize these services and can utilize these lessons and best practices to be able to implement appropriately and achieve the best results.
As the sun ushers the moon in at dusk, another child is born, another doctor, another farmer, another pilot. My hope is being restored. Another generation is set to be fed with health information. Their wisdom is dependent on the feeding practice that will mold and shape their future. I am glad that maternal, newborn, and child mortality is reduced. Once again, the sand retains its gold touch as it's vital to building and sustaining the pillars of life. Like my child, the Samburu child now has a chance to enjoy a promising tomorrow.